Hi, and welcome to another episode with Glam Up with Katrina. Now, today we're going to be talking about glamming up your skin, glamming up your face, glamming up your body. And I'm very fortunate to have my lovely friend, Dr. Yelena Belova.
Dr. Yelena is fine.
With us. And, she's a very, very busy lady. So I feel very fortunate. We're going to have a lot of education today on Botox, filler, Sculptra. So, Yelena, welcome.
Thank you, Katrina, for having me. It's actually a good opportunity to talk to people because nowadays there are so many misunderstandings about Botox, fillers, and this kind of things. Some people are very fond of it. Some people are very scared, and they think that they're going to look plastic or they're going to look done. So I think it's kind of a nice opportunity to give people the true information about that.
Absolutely. And you are a master at your craft. We knew each other because we worked together in the same clinic. So give our viewers a bit of your background. Where did you study? How long have you been in Dubai?
So I'm from Kazakhstan. I'm originally Russian, but born and raised in Kazakhstan. And I have studied in a medical university for 9 years to become a dermatologist. So I first finished 7 years to become like physician general practitioner, the same thing, and then 2 more years of dermatology residency. But I never practiced clinical dermatology like psoriasis and all this kind of skin diseases because I knew from grade 5, I think I'll go into aesthetic medicine. Then as I finished residency, after 1 more year in Kazakhstan, I came to Dubai. It's now been 4 years I'm practicing here.
Amazing. Yeah. So, let's start at the beginning. What do you think the biggest mistakes are that women make when they go to get injectables?
One of the main mistakes, I think they are starting to look for a treatment. Like they start thinking, okay, what will be the right treatment for me to do? They start Googling and do their own research, which is good at some point just to have the understanding. But I think that it's better to find the person, the right doctor that you will just click with, that will give you enough information because there are like so many things are written in Google that are absolute like nonsense. And it's much better if you find the right doctor, someone who will give you the correct information, someone that will give you the right feeling, and you can take it from there. Like this person will guide you better in terms of what will be the process and what you really need to look better but still look yourself.
Yeah, obviously for the viewers that don't know, I was in anti-aging for 26 years as a facialist and a therapist. And I think what you've always got to ask your patient is, what do you want to achieve?
Exactly.
Okay,
yes.
That's one side of it, but here's what I think you should do. And I think that's a good doctor, a good therapist will always ask these 2 questions.
Yeah.
What age should you start these things? Because I think for me personally, somebody that's much older now, I think young women are starting far too early with Botox, injectables, lip filler and all the rest of it. What's your take? Because you're still very young yourself. So what do you say to that?
Well, I'm 31. I have started Botox just in one area on my face, like for the frown lines, because I know genetically this area is like prone in my case for having creases. So just maybe as an educational moment just to see how it works when I was still studying. Like, of course, you want to try everything on yourself. But it's a good question because for the Botox, let's say, there is no such thing that you have to start Botox at this age or at that age. There is no such thing as too early or too late. Too late, yes, there is. We are talking mostly about the indications.
Yeah.
So when you see that the person has too many expressions on their face, some people are very expressive and they have genetically thinner skin. They are more prone to wrinkles and creases. And sometimes even in the early 20s, you can see a lot of dynamic lines and some, especially Eastern European groups like Serbian, Croatians, like they really have a lot of expressions, thinner skin. And like if they don't start Botox in their 20s, let's say someone can start 24, 25, 26. They will just end up with the deep lines that are not treatable with Botox. And it's also one of the misconceptions that it can get worse after Botox, which is physically impossible,
yeah.
because the wrinkle gets deeper as long as you move too much with your muscles. Once you don't move, it doesn't progress. It's completely impossible. So yeah, as long as you are sensible with Botox, you just have to follow the safe gap between the treatments, not to become immune. And that's it. I know so many patients that are doing Botox for 10, 15, 20 years. They just look their best.
That's me.
Exactly.
Although I need my Botox, Yelena, please.
Okay, next
to me
week.
soon.
We're going to do it next week.
What about the different types of Botox? Because you've got Dysport, you've got Algarin, you've got the Korean products now coming into the market.
Exactly. Like, in the end of the day, the product inside is the same. It's botulinum toxin type A, but there are different brands that are producing the same thing. They just have their own technology to make the product clean, to make it stable, to make it more long lasting. So they just have some small certain moments that are different from each other, but at the end of the day, it's like you have a car, you have Volkswagen, you have Mercedes, you have this and that, but it's just the car that are going to bring you from A to B. So it's kind of
I mean, I have to say that I've always had Dysport that works very well on me and almost instantly.
Yeah.
But the Korean products I've tried a couple of times and they don't last on me.
To be honest, it's also very, very much individual thing. I also work mostly with Dysport because here in Dubai we have only 3 or 4 types of Botox available, and for me Dysport is the strongest, as the most long lasting. But there is also such thing as individual reaction. Some people, they love Dysport, it lasts for them. Some people are really better with the Korean products. Some, like, it depends. And the same thing with the duration. We say that the duration on average is 4 months. Some people, they have such fast metabolisms that it's only 2 or 3 months. Some people are lucky, for them it's like 6 months or so. So it's also very individual.
I mean, is that an age thing as well? Because I think the younger you are, the longer it lasts.
Sometimes even the opposite, to be honest, because the younger people, their muscle power and dynamics is stronger and it kind of recovers faster. Sometimes the older the patient is, we actually need smaller dosage of Botox because the muscle, just as the aging process, they become weaker and it doesn't require that much product. But it also depends from case to case. You have to examine each patient that you see.
Now, nowadays, there's a lot of fake products coming onto the market. I mean, I know I've actually seen a box of Dysport that's fake, and there's very little you can tell between, the boxes. And fillers the same. How would you recommend a patient know what kind of product she's being administered?
Answering that, we are going to the very first question that you asked me. It's better, first of all, to choose the right doctor and the right clinic, because the licensed doctor, the licensed clinic, they will never allow themselves to ruin their reputation by using fake products. As you say, you are more than 20 years in this industry. Even for you, it was not easy to kind of see which product is fake and which is real. So for the person who doesn't work with it every single day, it's impossible. Choose the licensed doctor, choose the licensed clinic. It's totally fine if you ask, okay, what product you're going to use. It's totally fine if you are going to ask to see the box, to see the expiry date. Like, there is the thing which is called registration number. Like, it's totally normal if you want to know all these things. But first of all, just choose the place and choose the doctor.
Filler. Now, there's all different kinds of filler. So can you explain the filler that you'd need for your eyes or your mouth or your neck, the boosters? Can you explain all of that?
So the most popular group of facial fillers, they are all made of hyaluronic acid. Hyaluronic acid is a natural product that our body contains, and we have really a lot. Like, our body has around 15 grams of hyaluronic acid. And it's in your joints, it's in your muscles, your ligaments, your eyes, your skin, everywhere. So all the products, almost all of them, they are based on hyaluronic acid. Again, the difference between different brands is how they're going to make it clean, stable, long-lasting. each company has their own technology for that. So about the application, there are different kind of density of fillers. Some of them are thinner, some of them are more thick, some of them are good for dynamic areas such as your lips and your eyes, because you have a lot of movements around those areas, and filler have to be like flexible. It has to look very natural, whereas there are areas which are more static, such as your chin and jawline and cheeks, and it has to look a bit more sharp, more volumized. So based on that, we also choose in the product. But again, it's not the area where a patient has to choose and has to decide. I like the question that you mentioned. What we ask patient is what kind of result you want to achieve, what you want to see on your face as a result to make you happy. And based on that, we are making the plan and we are choosing the product that are going to be the correct to use.
And then you've got thicker filler for different areas of the face, because there's Juvederm and there's Restylane. What's the difference between these two?
Juvederm has a lot of types inside Juvederm, from the thinnest one to the thickest one.
Okay.
So there is Volbella, there is Volif, there is Ultra 3, there is Voluma, there is Volax, and these are all different density, different areas, different indications. Restylane is a different brand, like Juvederm is a French brand, Restylane is Swedish brand.
So it's more of a brand name rather than a product.
The difference between Juvederm and Restylane is two different companies,
okay,
two different brands, but inside the Juvederm, inside the Restylane, you can find the full range of different fillers for different indications.
So it's a bit more complicated than one would think. It's not just
Yes.
a filler. There's many different types that you
Exactly.
can use.
This is also one of the misunderstanding that people think that, what is this? Like, I'll just go inject my lips with filler, like do Botox and stuff. There is a lot of science behind it, and there is a lot of anatomy, physiology, and biochemistry behind it. And each case has to be assessed differently. And for example, the result that you are getting with Botox and fillers, I'm not going to get the same result because I'm a different person. And when you come to injector and you say, okay, I want this kind of lips, it's good to show what idea you have, but it's impossible to recreate the same result because you're showing a different person that actually also has makeup and Photoshop on this photo.
And I think that's where women get very unreasonable, because they want that face exactly, and they don't realise that your structure is different, your ages may be different, your skin texture is different.
Your muscles, your dynamic, your symmetry. Even with surgery, the plastic surgery, sometimes you cannot achieve the results that are in your head. So what we can say about injectables.
So ladies, let's all get a little bit more realistic, okay?
That's actually also very, very important moment to explain to your patient what they can expect, what are going to be the realistic expectations, what we can achieve with the treatment and what we cannot achieve with the treatment, because otherwise they will just end up disappointed.
What about under eye filler? Because there's a bit of controversy about that. Some doctors say don't ever do it. Other doctors say if you use a certain product, then it is doable. What do you say about that?
For me, the under eye filler, the most important about this treatment is the right selection of the patient. Some patients that really have indications for that, it's not the dark circles, it's not under eye bags, it's only the volume deficiency under the eyes. It's the hollowness under the eyes that gives more shadow and the under eyes looks darker, but that's the only single indication. If it's right product, if it's done correctly, like the application of the filler has to be very deep under the muscle, like literally on the bone, and we cannot use needle in this area because it's dangerous. We can only use cannula, so it makes the treatment a bit more tricky and complicated. But if all of these rules are followed, the result can be very, very nice. But again, the under eyes is the area that we prefer sometimes to undertreat than overtreat. Yeah, it's better still to have a bit of hollowness to avoid any further complications. And one more thing that I always say the patient about two areas, eyes and lips. These are the most dynamic areas on our face. Like we have big circular muscle here, we have big circular muscle here, and these areas are very expressive. We talk, we kiss, we blink, we move, we laugh. sometime over the year or so, filler can move. Even if it's done perfectly, even if it's placed correctly, best product, best doctor, it can move because the muscle can push filler either towards the surface or above the lips.
I mean, I have a bit of bleeding always on the lower lip.
Yeah,
I mean,
so
every time we do it, it's fine, and then several months in,
it starts
it
moving.
does bleed a little bit.
Yeah, and it's not that scary. Like, also patients think like, oh my God, filler can migrate. Yeah, it can migrate. It can migrate within certain area. It will never end up from your lips or under your eyes or like on your neck. No. Like it's just around a certain area, and it can be easily corrected.
So you would only do filler under the eye for hollows, not for wrinkles?
Never for wrinkles, because also wrinkles means the skin became a little bit saggy, a little bit loose, and it will not hold the filler in a certain position. It will just end up baggy. So wrinkles are never the indication for
amazing.
Filler.
Okay.
Yeah.
Well, we all know you are the queen of lips. I mean, your lips are by far
Thank you so much.
the best. Something else I need to get touched up. I mean, I don't think you've done my lips for over a year. I mean, it really lasts, you know. So give us your secret about how your lips are so natural.
First of all, there is no secret, to be honest. First of all, I think also what you project is the same that you get. So nowadays, everyone has Instagram and they can show what kind of work they are doing. So I'm showing what is my way of doing lips. So I only get the patient who also want this natural kind of look. That's why they come to me. That's why we kind of agree on that. This is the first thing. The second thing for me, again, the successful treatment is always to understand what patient wants, what you can achieve in this case, and that's how you get the result that you get. I am very conservative with the lips, to be honest. I never like something which is over. Most of my patients, they tell me, okay, I want to notice. I don't want anyone to notice. I just want to look natural. I just want some natural plump, this and that. So that's just how it works.
I mean, I think the lips are the one area of the face that are a dead giveaway if it's done incorrectly. Yeah. And there's nothing worse than that duck lip, the lip that protrudes, from the side. It's just not a good look.
Yeah.
And you've really mastered that natural look, I have to say.
Yeah, because there is also the trick. Let's say there is certain capacity of your lip tissue. It can fit certain amount of filler before it starts moving. And you have to also explain it to your patient that, okay, I understand that maybe you want the bigger volume, but if I force more filler into your lips, you will just end up with the migration because there is no room inside and filler has to go somewhere and it starts moving.
So what about these women with the massive... I mean, it looks like their lips are going to explode at any minute. I mean, I think the doctors that do that are really just not ethical at all.
Yeah, sometimes, when people start doing it regularly, they might lose the sense of
reality. Body dysmorphia, we call it.
Exactly. And they see themselves every day in the mirror. They get used to it. They think, okay, it's fine. Okay, it got smaller. And they just keep on pumping it up. And you are right, there are some doctors that are, maybe some of them, they will try to explain, you already have the migration, but they're just I don't care, I want them bigger, that's it. Some doctors will not even ask, they say, okay, you want, just get it, and that's how it works.
So the next thing up would be Sculptra versus Radius. First of all, what are the difference between the two of them?
Let me first tell you what is there in common, because these are the products from the group called collagen stimulators. So Radius can be actually used as the filler also, but I don't do that because it's non-reversible. Radius is calcium based and Sculptra is polylactic acid based. So both of them are used to stimulate the growth of your own collagen in your skin. It's not supposed to volumize your face. It's not supposed to give the same volume as hyaluronic acid fillers that we discussed earlier. The only goal that we want to get is to improve your skin quality, to make it thicker, to make it more firm. The difference is the product inside. Radius is calcium, Sculptra is polylactic acid, and the way of collagen stimulation, let's say Sculptra, it has more immune system involvement, immune cells involvement. Radius has a bit different way. That's why, for example, Sculptra, it needs a lot of massage and it needs very even distribution, causes a little bit more of swelling. We are a bit more careful with the patient who are, let's say, immunocompromised in terms of like they have some autoimmune disease or like something is not 100% right. Radius is a bit more easy in this way. It causes less swelling, a little bit faster results. But if you compare the result collagen stimulation wise, Sculptra is much more potent. It's much stronger. It gives much more collagen production than Radius, let's say, according to the clinical studies, like when you check how much exactly collagen you got, the Sculptra.
I mean, a lot of doctors are favouring it, especially for older women, over filler because it gives you a much more natural look.
Yeah.
But they say that you should have one session per 10 years.
Exactly, yes, that's the right protocol. For example, if you're 40, you have to get 4 vials in 1 year to complete the course. If you're 50, it's 5 vials a year. So let's say if it's 4 vials a year, you do it every 3 months to build up the result, because collagen, to make your collagen grow, especially when we are in the age when the collagen production is much lower than the process of breaking down.
Yes, yes.
And also what is so much important for women, the hormonal level is going down, and estrogen is one of the most important hormones of youth, which is accelerating collagen growth, and we are losing this hormone like after 40 or so.
Yeah.
So this is also very important to correct your hormonal status. Like hormonal replacement therapy is very popular now, and it's really so much important to keep your health and youth on a certain level. Even for beauty, if you're going to do all these collagen stimulators, but your hormonal level is 0, it's very difficult. Like you can't count on really good
That's
results.
a good point. I mean, I've been on bioidentical hormones for a few years now. And I think if you want to be the best that you can possibly be, you have to go down that route.
Yeah.
And I think diet and exercise are super important for menopausal women. Yeah. And it's, you know, as an anti-aging expert, it's an accumulation of many different things. It's not just one thing that's going to give you that massive result that you want. You know, we have to stay realistic about it.
And it's a hard work. It's not like you take magic pill. It's like anywhere in life, whatever you want to achieve. Unfortunately, there is no magic pill. You do this treatment, like you take hormonal replacement, and that's it, you're gone. No, it's such a hard work every day.
I mean, I did do Sculptra once. I'm about to do the second one with you. And I mean, I didn't see a massive result. They say you see it immediately, and then after a few days it goes away, and then it comes back.
What you see immediately is just the swelling because it's a big amount of product.
Right.
We tend to lose volume on our face as we age. That's why when you see this light volumizing first day, your face look youthful, but that's not what we are trying to achieve with Sculptra. The swelling goes away. It's just a side effect of the treatment. And then over next 3 months, we're just waiting for the collagen growth process. It's also, the trick is that it's not easy to assess, like, do I have more collagen in my skin? Like, how you're going to assess it, right? It's just,
they say with
exactly, with the pinch
test,
with just the feeling. I don't know, when you wash your face, you feel that your skin is getting more firm, but it's a long process. And it's also very important to understand about aesthetics. When you want to maintain your youth, your appearance, not to change it, just to stay yourself, it's also a commitment. It's something that you have to do regularly. There is no magic treatment. Okay, the Botox and filler, it's one of my favorite in terms of that it can really give you immediate result. It's long-lasting result, it really makes a difference. But the skin quality, it's much more difficult process because we are trying to literally reverse the aging process that's happening in our skin on the cells level, on the molecular level, and it's not easy. And it's really like a second job that you have to do: the skin boosters, mesotherapy, collagen stimulators, all this to just maintain your youth and your skin.
I was saying the other day that, I hate to think the amount of thousands of dollars that I've spent on my body, my skincare product. And it is, the older you get, the harder it is and the more money you have to spend. It is an investment.
Yes.
But, I think if you want to be the best you can possibly be, then why not? There's and I think it always starts with good skincare routine. Good products are an absolute must. That's another important thing to mention, right? If you're not using professional skincare on a daily basis and you're paying thousands of dollars, dirhams to have all these boosters, Botox, filler, you're not really marrying the two.
Exactly.
I think it starts basically with good skin.
Yeah.
And then you build on that.
Exactly. I like how you mentioned about the investment, because it's really investment that sometimes you don't see immediately some results, but when over the years you meet a person that, for example, your age, and they haven't done anything, they didn't take care about themselves, that's the moment when you realize, okay, this is the return of my investment, right?
I always say when a woman hits 40, you can really tell whether she's looked after herself or not.
Yeah.
Boosters. Because for me, boosters, I think, have really helped my skin. I've been doing boosters regularly for about 18 months now. What do you want to say about boosters? For the neck, for the face?
Yeah, boosters are also the big group of products and the big group of ingredients. So we have hyaluronic acid, we have amino acids, we have collagen, we have vitamins, we have antioxidants, we have DNA, PDRN, this
salmon
product that got trendy recently, the salmon sperm, salmon DNA. But to be honest, this is such an old thing that we have for years in aesthetic medicine. Since I worked back in Kazakhstan, we already have this PDRN and DNA salmon. These products are amazing. They are good really for the skin reparation, for the anti-aging, but it wasn't just that popular before Kim Kardashian has done a salmon sperm facial on herself. The same thing that happened with Morpheus, remember? Morpheus is also a very old machine. Since I've been in Kazakhstan, we used to have it. But once Kim Kardashian done it, everyone started doing it. So
I mean, I must say that I do favour the salmon for my skin. It gives you the tightening and firming, I think, more than... I usually mix between that and the hyaluronic booster.
Yeah, most of the boosters, they are based on hyaluronic acid because it's one of the most important thing that you have to do for your skin is hydration, and the hyaluronic acid is one of the main ingredients for that. What I do is always the combination of products. It cannot be only hyaluronic or only DNA or only this. Boosters, they are multi-components, so you can do so many things. You can alternate them, and again, it's something that builds up. It's something that is called maintenance. It's support of your skin that you see on a long run.
And I think mesotherapy for me as well has worked very well.
It's inside the same group of skin boosters. Everything that is injected into your skin, you can call it mesotherapy or skin boosters.
If you were to choose 3 things that's going to help you age gracefully, what would they be?
I actually have reels in my Instagram for that, my top 3 favorite treatments. I would always put on the first place Botox. There is nothing better than Botox. If you still haven't tried, please do. It's amazing, honestly. It's a single treatment that will make not only such a good difference at the moment, it's a great prevention, because as long as you have Botox, at least your upper face is not aging that much. You're not getting more wrinkles. And plus, I love Botox from here to here. When you get neck Botox, jawline Botox, you can get a bit of a lifting effect. Again, we have to be realistic. It's not a surgical lift.
The neck Botox for me really works because I go to the gym and you have these bands that come up because you train and you're straining all the time.
And when you lift heavy weights, everyone who is doing sport, they always have very strong neck. And the problem is, for our followers that are going to see the podcast, the direction of neck muscle is down. attached to your lower face, and it pulls all the lower face down. So once you get this relaxation with Botox, it gives the lift, and it's also one of my favorite treatments. So Botox is always the king. It's number one. The second, I do love fillers. I would split the second place like between fillers and skin boosters. I do love fillers because when it's applied correctly, gently, when your doctor is delicate, what I love about fillers that our face tends to lose the volume with age, on the cheeks, on the lips also. And when you just recover this volume that has been lost, like you get this youthful look immediately, and it's very nice. It's very rewarding kind of treatment, again, if it's applied correctly and professionally. So I really love it. And the skin boosters, because if you don't have nice, good quality skin, doesn't matter if you are lifted, even if you have done the surgery, but if you have a lot of sun damage and dehydration in your skin, you're not going to look as good as you could if you do the skin boosters.
Yeah, it's
So,
true.
these
I
are top
agree
three.
with that. And what are the things that women come to see you for the most? I mean, I know that you see a lot of patients per day.
Yeah, I do see around 20-25 people per day.
Amazing.
Yes, it's a lot. Like, I do specialize on injectable treatments. We have the machines as well, and I do respect and love the machines, but I specialize on injectables. So Botox and fillers are my top treatment. Lip fillers, of course, as you mentioned, and I do a lot of Botox. So yeah, these are my...
And then what about machines? I mean, what about machines or laser? It's just such a big topic, and people are so uneducated about, I mean, there's so many different protocols that you need, depending on the individual.
Yeah.
And where do we start?
I feel like the problem that we have in Dubai about that people are going for something that is trendy, that is popular, that is fashionable. They just go for it. That someone has done and it helped them, like someone promoted. But especially with machines, it doesn't work like this. Here in a hot country, we have a lot of darker phototype, let's say 4 and 5, and you have to be very careful with the lasers.
Now, just explain to the viewers what that actually means.
Okay, it's just darker skin types which are more prone to pigmentation. Okay. And you have to be very careful with the lasers that are damaging your skin surface. Let's say like fraction lasers when you like peel off, and it can just make things worse. There is very popular machine which is called HIFU. HIFU is the same that is ultraformer, Altherapy, Softwave. All of that is based on HIFU technology. HIFU means high focused intensive ultrasound. So all of these machines are based on deep, intense focused ultrasound technology.
I wasn't so impressed with that machine, I have to say.
Yeah, because it's not for your skin type at all. It's good for chubby faces, for double chin, for like heavy jawline. When you want to make reduce the fat amount, it's never good for faces that have already bony structure and not much of the volume.
I mean, another thing that people don't understand is radio frequency. Too much of it can actually melt the fat. Exactly. I mean, this Althera treatment,
Althera is actually HIFU. Althera is one of the HIFU, not the radio frequency. Yeah, Althera can also melt your fat, you're right. Radio frequency also can melt your fat. So, for example, Morpheus is the radio frequency machine, but with the needles. So the radio frequency energy is delivered directly through the needle to the deeper layer. And if you go, let's say, on your cheek fat pad, very deep with the high energy, and you melt your cheeks, you might end up looking older. And, that's, again, it goes to the right choice of professional that knows what they are doing. Each machine has their own protocols for different face type, for different area, for different agent type, for different, it's, as you mentioned, such a huge topic. So, I would never recommend people to do something that their friend has done and it looks amazing on her. It doesn't mean it's going to look amazing on you.
Yeah, and I think this is what people have to understand. It's all about education, right? Would you say these treatments are better for younger women?
Not always.
Not always.
Not always. Especially something like HIFU. No, it all depends on the skin type and face anatomy more than even age.
Body. What can we do for the body?
Almost everything that we do for the face nowadays, we can do for the body.
I mean, I know that the bottom filler to get your backside done is Hyalocort filler for the nether regions. Is it something that you offer?
I personally don't do it yet. You just have to have one specific certain certificate to start practicing. It's not really huge difference like for a doctor to apply fillers on different areas, whether it's face or body, if you know how to work with the cannula, if you understand the layers and anatomy, like okay, but it just needs one more certification to get, so I don't offer it yet, but it is very popular treatment in Dubai especially, I would say. So it has like pros and cons. Like the positive thing is like you don't have to squat in the gym for many years to get nice and round butt. But on the opposite side,
it's very expensive.
It is very expensive.
And it doesn't last that long, right?
To get really visible result on the bottom, you need big volume of product injected. And as you mentioned, the bigger volume you get, it's more expensive. Sometimes you need even 300 ml, 400 ml is not enough to create the projection that girls want nowadays. So they do 300 ml, then in 2-3 months they add. And as you mentioned, okay, even if it lasts you a year, imagine the amount of investment that you have to do through a year. It's like thousands and thousands of dirhams, like up to 100K probably, just to make the result visible, and then you have to maintain it every year not to lose the volume. So it is expensive, not super long lasting.
Would you say fat transfer was maybe a better option?
Still questionable. Okay, it's safer maybe in terms of that you can do it under general anesthesia and you can get big volume at once. But when there was clinical study that was assessing the safety in terms of sterilization. For example, you get the fat out of the body, you have to recycle it in a certain way to make it suitable to re-inject it again. So it's few steps and the risk of contamination, let's say, is high. When it's filler, it's already a sterile product which is pre-filled and it's safer in this way. So yeah, there are always pros and cons, but people are going for implants, for fat transfer, and then on top fillers, so they do everything.
The list goes on. Do you have any machines that you work on the body? In your clinic?
We have in the clinic.
You're an AIG clinic, by the way.
Yes. Me personally, I don't work with those machines. We have the certain therapists that are doing this. Yeah, we have Robalex, we have Bodylab. Bodylab, it's like myostimulation, instead of like going to gym, you just have those electric impulses that are making your abs instead of you. The Robalex is one kind of slimming machine to reduce the fat, but everyone who does it, they know that it only works as a small help when you are in your fitness journey, when you are doing your diet, when you're doing gym, just to speed up the process, to keep your skin quality good. That's how it works. But if you go home, you lie on the sofa and you eat unhealthy, and then you go and do the slimming machines, it's never going to work.
I think weight loss is another huge topic. Women are always looking for that quick fix, the easy way out. And there is no easy way out. Diet, food is so important. Then it comes exercise, how you take care of your skin.
And now there is Ozempic.
I mean, everybody that I see that's lost a lot of weight, it's my first question, have you been on Ozempic?
Yes, and some of them say no, and it's yes.
Yeah, totally. I mean, I've watched a few podcasts on that, and they say in very small amounts it's actually beneficial. But I think you have to go to the right doctor for that, you know?
Yeah, for sure. Like any treatment, it's a medication. As any medication, it has to be done under observation of the doctor. Some people, they require certain blood tests, and just you have to keep an eye on your health.
Has there ever been anybody that have come into you and you've refused to treat them?
Yes, of course. Yeah, there were cases. Of course, there were cases with lips when there is just no room to put more filler and they want more filler when they actually need to dissolve the old one. Yes, there were cases like that. There were cases when patient just has unrealistic expectation. They think that they're going to inject filler, like preferably 1 ml, and they're going to look like this for the rest of their lives, of course. And when you explain them that this is absolutely not possible, they just don't want to proceed. Or sometimes, our work involves a lot of interaction with people, and people are very different. And sometimes you become, even if you don't want, you become a bit of psychologist. And sometimes you see that you just don't click with this person. And whatever you do, the best way you do, they're not going to be happy. And you don't want this extra headache, and you just find a way to
be discerning.
Refuse. Yes.
Be discerning. So on closing, what kind of advice would you give to our viewers about going for injectables?
I think this is something that I'm repeating through all this podcast. Choose the doctor, check what this doctor is doing. If the result that this doctor is providing are close to what you feel, check how this doctor looks. If they look overdone and overfilled to you, means that this is their beauty standard, and maybe if your beauty standards do not match, just better don't go for it. Now in Dubai we have a lot of people, unfortunately, that are visiting, that don't have license, that work in beauty salon or hotel rooms or something like that. Don't hesitate. If you are not confident, don't hesitate sometimes to ask the documents, because one more important thing, if the person is injecting, it must be a doctor. It must be either plastic surgeon or dermatologist or general practitioner with a specific injectable privilege. That's it. Nobody else is allowed to inject officially by law. Don't hesitate to check the documents if you want to. And actually in Dubai, it's very easy. You can go to DHA website, put the name of the doctor and check what kind of license they have, if they have any.
I mean, there's just so much happening in Dubai at the moment where there's a lot of people working from home that are not properly licensed. And, I have friends say to me, oh yeah, it was only 500 dirhams for Botox and it's cheap. And I'm like, well,
the cost of Botox is more expensive than that. Yeah.
You'll only get what you pay for. And women, I think that the aesthetic industry is so overloaded. There's too much of everything and it's cutthroat. It's all about the price. But you have to look. This is your face. This is your body. There are no room for one mistake.
Exactly.
And I think
one mistake can cost a lot.
You get what you pay for. So, ladies, invest in yourself properly. We can find Dr. Yelena on Instagram under Dr. Belove, I believe. The name
Dubai.
is down below on the video. And thank you for listening. I hope this was informative. Your face, your beauty is something that you have to live with forever and ever. So choose wisely. Remember to have a look at my website. I have a free masterclass that actually talks about all the different things that you can do for your skin, different surgeries, different machines that you can use. That is free. You just sign up, katrinavalente.com. And stay tuned. We'll be coming back to you soon. Have a great day.
Bye-bye.